Hello everyone, I'm Dr. Barry. I'm a board certified plastic surgeon here with Wake Plastic Surgery. And today we're going to be discussing some frequently asked questions related to some of our commonly performed procedures. All right, so mommy makeover surgery, that's somewhat of an umbrella term. And so it describes a customizable set of procedures that aim to correct some of the changes with pregnancy, childbearing, and breastfeeding. Generally, we look at procedures including breast enhancement, as well as tummy tuck surgery or liposuction. So usually when we look on breast enhancement, the changes that we are aiming to tackle include often droopiness, or we'll call ptosis of the breast after pregnancy and breastfeeding, volume deflation of the breast. And in some patients, we have large breasts, sometimes pre-pregnancy and sometimes after breastfeeding, that may even become symptomatic. And so these patients often need either a breast augmentation, a breast lift, and sometimes even a breast reduction. And so the people who have volume loss after pregnancy and breastfeeding often need breast enhancement through breast augmentation. Oftentimes that is accompanied with breast ptosis or sagging, as I mentioned, and so those patients benefit from a breast lift. And these may be either isolated or in combination. For patients who have large breasts, they often benefit from a breast reduction. Tummy tuck operation aims to correct a few things. And so when we think about pregnancy, as we kind of go through pregnancy and our abdomen expands, one of the things that we see is separation of our sit-up or rectus muscles. This is a condition called rectus diastasis. And even after delivery, these often don't go back to their pre-pregnancy state. And so for these patients, they often benefit from correction of this with suture. Other changes that we see, often there are significant weight fluctuations, weight gain, weight loss with pregnancy and afterwards. And this can create a lot of loose skin in addition to the stretch that we see. So part of a tummy tuck operation also involves removing that excess skin from the lower abdomen, and often including liposuction to get rid of any excess stubborn fatty tissue as well. Mommy makeover surgery targets people who are unhappy with the changes that they're seeing after pregnancy, childbearing, and breastfeeding. And so ideal candidates are healthy without major uncontrolled medical problems, patients who are at their either goal pre-pregnancy or a healthy weight, and really anyone who is seeing the effects of pregnancy, childbearing, or breastfeeding in their breasts, abdomen, sometimes even their arms, thighs, and face. So most people wait around a year after childbirth, sometimes 3 to 6 months after breastfeeding, and this allows enough time for your body to adapt back from the changes brought on by pregnancy and breastfeeding to go back to a normal state before surgery, and also gives enough time to get through those first several months to allow for adequate child care, which is an important consideration. So it depends on what we do as far as recovery time goes. Generally, the muscle tightening from a tummy tuck operation creates the most downtime of all of these procedures. And so after a tummy tuck, we usually would say plan for 1 to 2 weeks of downtime. After most breast surgeries, 1 week of downtime is usually a good kind of time frame to plan for. These are done in combination, so in terms of taking time off work. Usually people are well enough to go back to most jobs that don't involve strenuous labor after a week for breast operations, and after 2 weeks for operations including a tummy tuck. But as far as restrictions go, usually these are all fully lifted at 4 to 6 weeks, and people kind of ease back into full activity between those 2 to 6 weeks. So we definitely want patients up and walking from the day of surgery, but we try to limit exercise that significantly raises your heart rate for the first 1 to 2 weeks. And between 2 weeks and 6 weeks, we usually are increasing our activity as tolerated up towards full activity, but really avoiding any strenuous lifting or anything that creates discomfort during that time for sure. So, as I mentioned, one of the components of a tummy tuck surgery is removing that excess lower abdomen skin. And so any stretch marks, even sometimes tattoos or C-section scars within that area, they're often removed. We usually aim to remove any C-section scars along with a tummy tuck operation. And any stretch marks that are usually below the belly button within that area that we tend to remove tissue, which is where people tend to see the highest burden of stretch marks, will be removed. For stretch marks that extend outside of that area, usually the upper abdomen, those are generally pulled down to a less visible location, but are not removed. So, one of the concepts that are important to consider with liposuction is that we have, in general, a set number of fat cells in our body. And so these fat cells get larger or smaller with weight changes, but don't increase in number. And so one of the benefits with liposuction is that we remove these fat cells, and so you have fewer fat cells to get larger and smaller. And what that translates into is more resistance to gaining weight in areas that you've had liposuction. And so while if you gain significant weight, you could absolutely see an increase in weight in those areas, you are more resistant after having liposuction to regain weight in those areas. Most people can expect to see their results or a good idea of their final results after around 3 months. That's when the majority of the swelling is gone, but they will continue to see improvements in the results as swelling continues to improve for up to a year after surgery.